Good evening, and I'm Sandy Reinecker. I'm very pleased to introduce Wes Ingram, who's the program director for NAMI Delaware, which is the National Alliance on Mental Illness, and Lieutenant Harold Bozeman of the Wilmington Police Department. Lieutenant Bozeman has had over 27 years of service as a law enforcement officer and is unit commander for the Community Engagement Unit. For the past 10 years, he has served as coordinator for the CIT, which is Crisis Intervention Team, Training and Implementation. More recently, the Wilmington Police Department has launched a program entitled Partners in Care. We're so interested to hear about these programs, and we thank you so much for being here, Wes and Lieutenant Bozeman.
Thank you. Thanks for having us.
Yeah.
So we did a presentation for Wilmington City Council a while back. They were asking questions about the crisis intervention team and how the evolution of it, how it came to be, and kind of just the basics and mechanics of it. So Wes prepared a presentation that he's sharing now. Same one for the City Council. And then we would love to have some questions and some discussion about CIT and about the Partners in Care program as we go along or after we're finished. So I'm going to let Wes get into the history of it a little bit, and then we'll discuss.
Yeah, thanks. So CIT stands for Crisis Intervention Team. It's a program and a training, and it's it's international, but it began in the United States. The history of it is it was actually started back in 1988 in Memphis, Tennessee. So there was an unfortunate incident in which a Memphis PD officer had an interaction with a man who had very serious mental illness, and it ended with him fatally shooting this man. And of course, this was a very upsetting moment, and it brought together the Memphis police and our national organization. So we're the Delaware state chapter, but NAMI is a nationwide organization. So the sort of national headquarters of NAMI and the University of Memphis, and they all partnered together to kind of develop this training program in order to give more information about mental illness and how to recognize that somebody is living with a mental illness and in a mental health crisis for officers, as well as to give them more de-escalation skills. So to be able to kind of interact, because it can be difficult with somebody who has, who is in a psychotic episode, who is in a crisis, and there are a lot of different tactics that are not necessarily taught in the basic academy classes. So they created this training program to be able to kind of address that need. And so far it's been implemented nationwide as well as in other countries. And they have an organization called CIT International that kind of helps with all these different trainings in different areas, providing guidance and whatnot, and everything. As I was mentioning, it's a training for law enforcement officers to kind of be able to enhance their understanding of mental health and the skills to de-escalate somebody who's in a crisis. It's specifically a week-long training, so it's 40 hours, Monday through Friday. And it's all about different topics on engaging individuals with a mental health condition. So the cool thing about it is that it is a little bit customizable. So each state that has CIT and whatnot is able to kind of tailor it a little bit with the guidance from CIT International to best fit their community and their community needs in terms of the different topics, along with just the general mental health info and everything like that. So each one will look a little bit different depending on what state that you're talking with and whatnot. There's always an interactive component so that the officers are practicing their skills in different ways. So we do like a scenario, we do like scenarios, different scenarios that they go through, so that they can have that like sort of hands-on experience, while there are other like CIT officers and like mental health clinicians and whatnot are there to kind of help guide them in a way that's very like safe, but still realistic. And then we also have a follow-up program for law enforcement that's specifically veterans or otherwise like military associated, like the Guard or the Reserves, called Veteran Response Team, with the idea that once you're trained as a CIC officer, if you also have this military experience, then we can go through a class on how to kind of de-escalate, specifically a veteran in crisis, while with kind of using that military experience as a bridge to connect with them. And that's 16 hours. So that's a 2-day program.
Hey, Wes, before you move on, can I expand on some of this?
Yes, of course, please.
I think some of the important things to point out about the CIT training, a lot of people hear about police training and they think of in-service. I know I do after all these decades. I think when I hear police training, I think it's a bunch of people who are in a room who are ordered to be there or who have to be there to keep their certification, and they may or may not be absorbing it. The important thing about CIT and then the follow-ons, the VRT and the advanced classes, all of these officers are self-selected, which means we put out a training bulletin and say that it's available, and we collect requests from officers who want to attend this training. So they have a desire to learn this and they have a desire to go out and do this work. And then from, at least in Wilmington, from the requests that we receive, we select 6 or 8 of the officers who we think have a particular aptitude or have the talents to do this or have the demeanor to go out and work with this population. So it's important to note that these officers are volunteers. They go of their own accord. And they're the ones who have expressed a special interest or a special aptitude to do this work. So unlike other things, legal updates and policy updates and things like that, that everyone is forced to sit through, the officers that are attending this are the ones who really want to do this, and that's what's important. As you said at the beginning, this is our 10th year. We started in 2014. With NAMI. We actually just had our 10th anniversary class in April. And in that time, we've trained between 30 and 40 police officers twice a year. A couple of years we did 3 times. So there are now 800 plus CIT officers who have been trained in the state of Delaware statewide. We have 83 of those just in the city of Wilmington. So these officers are on the street 24 hours a day. In all the jurisdictions across the state. So it's a network of officers that are specifically trained so we can avoid situations like the one that started CIT. All right, Wes, thank you. Moving on.
Yeah, so that's getting kind of into that too. It's kind of seen as an entire program. Like, it's at its base, it's a training, but it's also kind of more than that. We want it to be like a program that is really, that we really encourage officers to stay engaged with, through like, continued trainings, as well as through, these partnerships and whatnot, and policies. We'll talk about that in a little minute. But yeah. Kind of going off what Harold was just saying in terms of it being being self-selected versus mandatory. I think that's probably the one thing that people are most surprised about. And honestly, when I first started, so I started coordinating these classes in 2018 when I was hired on as like an office manager and whatnot. And of course, the first time I hear about this, I'm like, oh my God, everybody should do it. It should be mandated. But then when I learned more about CIT and the fact that the way that it's structured, it's meant for officers that are really passionate about mental health and helping the mental health community and whatnot. And, then once an officer is trained in CIT, it's meant to that those officers are the ones that are going to be prioritized to go out on those calls. And so when it's mandated, it makes it a lot harder to be able to tell who is actually passionate about it and who has like the empathy and the patience and whatnot to have to go into these really difficult situations and help versus officers that are better suited for other tasks. And so CIT, that's why CIT is like a national best practice. And we've seen that research really has shown that arrest rates and arrest rates are like decline after the CIT programs implemented. We see increased rates of actual like referral or transport to like mental health services versus just arrest when we're comparing like between CIT officers compared to non-CIT officers. And then there's this one really interesting study where they actually like kind of put on a scenario in which a mental health crisis began and kind of escalated, and it showed that CIT officers were, it's worded kind of weird, and I put the actual wording of the study in there, but basically they were more likely to spend time on de-escalation and not immediately choose force versus non-CIT officers. So of course, we think that this is a really great program, but again, it really takes the people that are passionate about it and that have the aptitude. And when, and we see that when there are a few states that have it mandated, and that's kind of where issues come in because sometimes incidences still happen, and then that's used to kind of undermine the program. One of the most famous examples is that Derek Chauvin was CIT trained because that was a state that had it mandated. And so every single officer is trained. And so people can use that to kind of undermine. But when it's used, when we're doing it in more of the way that officers are choosing to go into it and being selected based on their own interests and passions and whatnot, we see that it is a best practice and that the research has shown it as very effective. One of the great things about CIT is that it really helps connect officers to resources. We do a lot throughout the training where they have interactions with service providers and whatnot. They're able to get contact information to help with potential issues that they may be seeing. And we also kind of receive feedback like surveys and evaluations and whatnot. So it really helps us to understand what the officers find relevant to what's going on and whatnot, as well as it also helps us hear about kind of the gaps that they're seeing that those of us who aren't like out on the streets and responding to calls and whatnot that we wouldn't otherwise know.
So in years past, as you can imagine, the options and the resources of the police were limited. I've been doing this since the late 1900s, I like to tell people. And when I started, there weren't really a lot of options for police officers to resolve situations. If someone was acting out, and if someone was acting out violently or in another criminal way, the options were arrest or the Delaware State Hospital. And the Delaware State Hospital was rare. That was only in cases where we knew or whether a family member told us there was a mental health condition involved. Otherwise, we were arresting a great many people who were probably in crisis, and that's why they were acting out. So with the partnership with NAMI and other care providers and with the CIT training and the resources that come with that, in the last 10 years, we've really seen our ability to creatively problem solve increase. We have options now available to us that don't involve arrest and detention and handcuffs in court. And in cases where we do have to arrest people, despite the fact that they have a mental health condition or were in mental health crisis at the time, Delaware has a mental health court. So the officers that are trained to recognize it can make specific referrals so that as they move through the legal system, the defendant's rights are protected. And the judges can sometimes mandate treatment as part of the sentence as opposed to imprisonment. So it has opened up our world. It has opened up a lot of available options that we didn't used to have. We used to solve all of our problems with handcuffs and jail cells, you know, going way back a couple of decades. And now we're seeing that, as Wes said, turn around. Arrest rates are declining. Referrals and transports to services are increasing. Uses of force go down in cases where there's a mental health crisis. And my CIT officers are far more likely to de-escalate than some untrained officers might be.
Yeah, it helps. We've seen through officer feedback too that it helps, as Harold was just saying, for officers to kind of like take the lead in situations and to actually utilize like de-escalation and whatnot. We see that they are the ones that are like going on the mental health related calls more often, and also just that is they stay involved in the process a lot of the times. They volunteer a lot as role players for our scenarios portion so that we have very realistic scenarios for the participants that are going through it. And it also helps again with those keeping those relationships with providers and whatnot, since we have it set up so that we have kind of like the role players, and we always also have both a law enforcement and a mental health evaluator in the scene as well to provide feedback and kind of explain like why a situation might be, you know, not crisis specific, or why, you know, a certain technique might not be the best in that case, from both aspects. And we know that there's a really high turnover rate in the mental health field. So this becomes really important because, you know, you might go through the training and then come back like a year later and you see to help out with scenarios, and you see that the providers that you met when you went through are maybe not necessarily the most current contact. So all of this is like really helpful and important for, you know, the continuation of the program and the way that it helps officers while they're out in the field. And that's all of my slides, just for the background and whatnot. Harold, do you want to talk a little bit about the Wilmington, your new partners in care units? Yes. Yes.
So I put a link for everybody in the chat for our Partners in Care program. When Chief Campos took over in January of 2023, he called me and said, and I happen to be in Disney World, but he's the chief, so you take his call. He called me and said, I want to re-implement the community engagement unit. I want you to be the commander. I'm going to give you 6 officers. Take your time. I want it to work. Let's rebuild it based on my community policing experience. So I did that. I started at work on that in January, early February of 2023. A couple weeks later, he called and said, I'm adding 3 more cops to your program. You now have 1 for each patrol district. Take your time, get everything settled, assign people as you see fit. About 2 weeks later, he said, that's enough of that. I have a new initiative I want to start working on. You've had long enough. So he had in mind that he wanted a co-responder program that's similar to what they have in Newcastle County. You've heard of Hero Help. Newcastle County has a pretty large unit of police officers and clinicians who do substance use disorder, mental health crisis, long-term mental health disabilities. And they do follow-ups and they do referrals for services. And they have clinicians that go out in the cars with their police officers. Chief Campos wanted something like that. Not on as large a scale. We don't have the facility. We don't have the officers that they do or the resources. But he wanted to start something. So we spent the better part of the next year working on contracts with Christiana Care, writing a job description, working with our providers, building some partnerships. And we finally hired 3. We just finished our first 90 days. So we have a social work case manager who's in the office with me. He does all of our follow-ups and referrals. And then we have 2 clinicians that go out in the field. Each is partnered with their own police officer. And they go out for 8 hours a day on 2 shifts. So they're working from 6 a.m. until 9 p.m., Monday through Friday. And they're out in the field answering all the calls that have either a mental health, a known mental health disorder, a mental health crisis, or a substance use crisis, suspected or known. And when they encounter these people, they do referrals. Right, we have a network of services for housing, for substance use, for mental health treatment, for veterans, for a variety of different communities and populations. We have compiled a list of resources. So they go in the field for the initial contact. They'll write a report for me and the case manager, and then the case manager will do follow-ups. He spends his time in the office calling providers, trying to connect people with services, trying to reconnect people with services they've lost touch with if they've had their own providers. And the good part about our program is that our clinicians are under contract with us, but they are employees of Christiana Care. So we have the benefit of having access to Christiana Care's community care network and all of their resources, vast as they are, their clinicians, their health resources, their mental health resources, and then all of their outsourcing. We have access to all that through our program because our team works for Christiana Care under contract to Wilmington. So they're handling all the calls for crisis, either substance use, mental health. They've handled quite a lot of homelessness, trying to connect people with services. They're working with a family right now, a family of 5 who we found living in a park, 3 children and 2 adults. So we're finding housing for them, but that's the kind of work that they're doing out there. So like I said, we've just finished our first 90 days. We are fully funded through the end of 2025. And I think we have a commitment from Christiana Care to take up paying for it themselves after our grant money runs out at the end of the year. I think I'm sorry, Wes, it bears mentioning the officers that work with my clinicians and my case manager are all CIT trained. That's an important part of the program. So we went back to all the officers who previously requested and received this training, and we reevaluated and reassessed them, and we chose some of the ones who are best at applying the principles of CIT and crisis intervention, and we teamed them up with our mental health clinicians. So it's not just any officer off the street. All our officers are talented in their own way. We chose officers that are specifically specialists in this field to work with our clinicians and case manager.
Yeah. And that is just like so important. And, doing CIT and working with all these departments and everything, and hearing everything that the officers are, talking about what they're seeing and whatnot. It makes me realize like how important this is, especially in Delaware. I don't know if a lot of people realize, but we don't really have any transportation system for crisis that isn't an ambulance, and an ambulance is not always applicable. So if it's not, then the only way that somebody who's having like a very serious crisis can get to the hospital or crisis center a lot of times is from law enforcement after 911 is called. So since it makes a huge difference being able to respond to that call with a law enforcement officer to provide the safety of everybody that's involved, and then the clinician to actually be able to help with the de-escalation, and bringing that person to an appropriate like treatment facility. So yeah, I'm so happy about this program and whatnot. And yeah, does anybody have any questions for us?
I think what I'd like to share is that if any of you have family members, friends, loved ones, people that you know about who have a known condition or who may end up in crisis at one time or another, or who has ended up in crisis at one time or another, we have, and it's Newcastle County, and maybe statewide at this point, we have enhanced 911. So what you can do is you can call the 911 system for the jurisdiction where your police are dispatched, whether that's Newcastle County, Newark, Wilmington. You can call in and ask to speak to a radio supervisor, and you can actually have information added to a person's address. If they have dementia, if they're prone to wandering, if there's someone there who's living with autism, if there's someone there who is living with schizophrenia, or they have any of these other conditions where acting out may complicate interactions with the police or with EMS, you can have notes added to their address. So that when it's dispatched, our dispatchers can see that. When they call in and that address comes up, our dispatchers get all those notes and they can relay those notes to the officers in the field to be prepared for what might come. It's as simple as things for people with autism. You can put notes in there about what sets them off, what triggers them, what they're uncomfortable with, what calms them and helps them communicate. So you can add all of these things. It's plain language, so you don't have to choose from check boxes or text boxes. You can add whatever information you think is appropriate and helpful.
Is
I
that
have a
Smart
question.
911?
Smart 911. Yeah, I'm sorry.
Okay. No, I just wanted to make sure it was the same program.
Is that a different number, or it's just by virtue of asking for?
No, so if we have a non-emergency number in Wilmington as well as 911, but I like to tell people it's the same 4 people answering the phone, no matter what number you call. It just, which number you call kind of sets our computer's priority on how that call is routed through our system. You can call either number. You can tell them you're calling to add information to Smart 911.
Sure.
And they'll connect you with a radio supervisor, or you can ask for a radio supervisor to get that information.
Roger,
Yes,
did you have a
question.
question?
Sorry, I have a question. I can't seem to get my raise your hand sign here. I have a close friend who does have a child with autism, who unfortunately is having a very dysfunctional relationship with law enforcement. Indeed, this young man in his 40s has been charged with something that I'm not sure about, and is actually in the court system currently. This creates a lot of also mental distress with the mother. So the family is involved in the effects of this distress. The mother trying to escalate a son who is on medication, who are having altercations from a neighbor who distresses them, bullies them, agitates them. And she, as a senior citizen, seems to have no protection against this neighbor. And he, as a young man in his 40s, also seems to be now, unfortunately, in the legal system. So I don't know. You're telling me that there's a way of escalating, de-escalating, and yet I find this poor family now in a court system where he's going to have a charge, and to have someone with mental health convicted of something. I don't know if this will be a felony. You know, I'm not cognizant of all the legal permutations. Frankly, I find that very escalating. So is there anywhere, this woman has gone everywhere, to every level of mental health, to every level of police in her community. She has gone to various people in the community. She went to arbitration, and nothing has resolved this problem. She cannot move from her house, which obviously would be a solution. But I don't think the police has been a helpful arm of this, unfortunately. And it is clearly the mental health consequences of this young man. He is bullied about his mental health by his neighbor.
So
And
first,
what would you suggest?
I'm very sorry. It's terrible that this family is going through this, and without the perception that they have any help. And I feel terribly about that. The first thing they should try to do, if they haven't, is to try to have his case transferred into the mental health court. And if they're represented by an attorney, the attorney is the best way to do that. If they're not represented by private counsel, the Newcastle County Courthouse, if they're in Newcastle County, I think probably every county has it. I'm only aware of ours, but there are hours at the Newcastle County Courthouse where there's something called the Self-Help Center, where you can go in and get maybe 30 minutes of legal assistance from an attorney. And I think that if they're not represented by private counsel, they should go to the Self-Help Center and talk to one of these attorneys that's offering this pro bono work and see if they can get an idea of the paperwork that needs to be filed to have this transferred to the mental health court. I think that is number one. That's the most important, is to get this man into the most suitable, the most appropriate part of this system. Criminal court probably.
He is unfortunately, or fortunately, I don't know which way it goes, represented by counsel.
Okay.
Whether that's going to, be resolved. I just hate the idea of this young man having charges put on him. I don't understand the legal system, but if I have charges and then you pull me over and you look at my name, you will see that I have some charges on me, correct?
We don't always check someone's criminal history. If you happen to be out and about and you get pulled over, the things we'll see is whether your license is valid or not, and whether you have active warrants out for your arrest. But as a routine, we don't generally just check a criminal history as a matter of our day-to-day. Unfortunately, he was probably arrested because, as I said earlier, whether or not a person is in crisis or experiencing a mental health disorder, if they've acted in a way that a crime has been committed, the police have to take action. I just want to make sure that people end up in the right court system, because if we can show that the criminal activity, the criminal behavior was caused by a mental health crisis or a mental health condition, then the mental health court is the most appropriate place for that, so they can resolve it. The judges in the mental health court attend CIT training, and they send their clerks to CIT training, so they're well aware of us as well as we are of them. So they know that we're making referrals, and they're asking us for referrals. Sometimes an officer who hasn't been through the training doesn't make that referral, and that may be what happened in this case. That's why I said if you can give the advice to them to have their attorney at least petition the court to have it transferred, that's probably a big first step. If they're in Wilmington or Newcastle County, the next step is to call or contact Smart 911 and have some notes added so we can see the history. We're more likely to hear about the notes in Smart 911 than we are about someone's criminal history when we come in contact with them in the field, quite honestly. We're only looking up criminal histories if we actually have new charges and we take them into custody and they have to be arrested again. So
if you call 911, you ask for Smart 911?
Yep, Wesley posted a link to it as well. There's a website that explains the process, and I think may give you access from there to some forms.
So when someone calls 911, I haven't done this yet, thank goodness. But do you get asked certain questions so that they're determining whether there is a mental health or a substance use component to know whether they need to contact you or just another officer? So
there are standard questions now that must be asked, and health and mental health are among those questions. It's formatted in such a way that our call takers have to answer certain questions before they can move the call forward toward the dispatcher. So yes, those questions are being asked and answered, even if it's very rudimentary. My advice to people who call is to volunteer as much information as you can, especially if there's a crisis or a condition that we need to know about. Then we're not depending on someone who may or may not be an experienced call taker or dispatcher to gather all that information. I say volunteer as much as you can, and they'll get it into the notes. But yes, there are basic questions that they are prompted to ask before they can move the dispatch forward. So they have to ask them before the computer will let them proceed.
And so it's the dispatcher who determines whether it should go for sort of a straightforward law enforcement issue, or if potentially there's a mental health condition involved, and then it would be dispatched to someone else. Is that kind of the way that triage or that tree works?
Yeah, so I have my CIT officers deployed in such a way that Wilmington has 24-hour coverage. There are always CIT officers on the road as part of patrol, and then other units, my detectives and my drug cops and other units, my community engagement specialists. We have a mixture of CIT officers throughout the department. And so we always have some available. It's 24 hours a day. It's baked into our culture at this point, a decade in, that our dispatchers know that if there's a mental health component or substance use component, they're to call for the CIT officers first or ask for one to attend that incident as backup, even if it's not primarily their complaint. And the officers who are assigned to partners in care are actively listening, even if they're not sent to a call. They're actively listening for clues that there may be a crisis component to it, and they're actually self-dispatching, and they're going to help the officers with those. So we have the system, we have kind of a redundancy set up in the system. The dispatchers are trained, and it's baked into their training and their procedures. And our CIT officers are always out there, and my partners in care are listening up just in case something gets missed. So we have a pretty good system of redundancy built in, at least in Wilmington, and I think everyone else does as well.
Are
Do
there
you have
statistics
mechanism
oh, I'm
of-
sorry, go ahead.
I'm sorry, so do you have a mechanism of assessing the responses? For example, when did the CIT not go as well as we would want it to have been? Maybe there were more incarcerations or more need for force, or something that shows escalation, which obviously you're trying to diminish. Is there some review of the system?
So these are things that we do review. We have a system in place called REDCap. REDCap is a case management software that was developed at Vanderbilt University, but what it allows us to do, in our case, we've specifically tailored it to track our CIT complaints and our mental health complaints. It allows us to do follow-up, but it also allows us to look at outcomes. We can make notes about whether there was an arrest, whether there was a use of force. We cross-reference the police's report number, the police officer's report number, so that we can go back and read the report and find out if there was a use of force, what prompted it, what level of force was used, whether a CIT officer was dispatched, or whether the condition was known or unknown at the time. So yes, we can track all that. We have a pretty robust system for keeping track of those things, and we can always go back and research it according to the person's name, the person's address, or the police report number. So we have multiple ways of searching incidents as well.
And I'm sorry, one more question. Do your CIT officers, do they have other training, for example, in what is it, in bias training or other kinds of, I think, de-escalating trainings, in addition to their CIT? Are there some other trainings required?
So all the police officers in Wilmington, and I think it's a council on police training standard, so I think it's probably all sworn police officers statewide, annually take bias training, anti-bias training, de-escalation, like verbal de-escalation, physical de-escalation. So these are mandated components of in-service every year. So the officers, every officer has that, and then our CIT officers have one more layer of de-escalation that's specific to people in crisis.
Thank you.
And I just want to add to, so NAMI Delaware has what's called a helpline. It's not a crisis line, but it's a phone number, or we have a contact form on our website now that people can reach out to for resources and kind of to know, like, you know, what is out there for their situations. And so we have definitely received calls very similar to the one that your friend is going through, unfortunately. So in those situations too, people can, you know, the family member can always call our helpline. and we can try to help connect them to like they're kind of like next steps like that. Like I know in one situation a couple years ago, we were able to reach out to actually the officer that responded and say like, hey, did you refer this person to mental health court? And they went, yeah, I did. So we were able to kind of double check that for the family member who wasn't sure if their loved one had gotten that referral or not. So and we also run like family support groups, a lot of which are virtual and whatnot. Because in a lot of cases, sometimes they're just everything that can be done has already been done. And now we're just kind of in a holding pattern of like waiting for the courts to proceed with, that first, however the system is, I'm not that familiar with it either personally. And that is really hard on families. So sometimes the only thing that is really available is getting that support and going to a group and hearing from other family members, saying like, hey, my loved one went through that too, and it's hard, but we got through it, and this is what happened with us and stuff like that. That's very common. So I definitely feel for the family and that individual who is struggling right now. It is still, unfortunately, even with these programs in place and everything like that, it still unfortunately happens, and they're definitely not alone in that. Are there any other questions or comments?
Just one more observation. I find that, and I'm a Hispanic, I find that Hispanics and women in general, Black men, because of their experiences, can be very intimidated by the presence of law enforcement. They don't they may not necessarily know that you're a CIT trained officer. Their experiences may have been very negative in the past. And so the fear and the adrenaline that flows through them at that time, I can only imagine. And I hope that indeed your training is indeed what helps to calm them and de-escalate that, which is obviously the first step that's necessary, because it can be very frightening. I'm a law-abiding citizen, and I see a cop car behind me, and I'm already thinking, what did I do wrong? That comes from my culture. Maybe that's the ex-New Yorker in me. I don't know. But it's not an easy, comforting feeling. I can say that, and I have no reason to be intimidated, but it can be intimidating. I just wanted to make sure that was said.
Yeah, absolutely. Thank you.
It's very, oh, go ahead, Roger. You put your
just a question about officers being alone in cars or in teams. What's the situation with CIT officers? Are they just regular officers alone in a vehicle or on a beat? I'm not sure how that all works. Or do they have partners?
So our officers are deployed in a variety of ways. We get the most coverage by having officers deployed differently, which is to say every district has a 2-officer car who will go handle the really emergent complaints or the complaints that maybe are more dangerous or more threatening or require 2 officers, like a domestic or a fight in progress, maybe a shots fired. So each district has a car where 2 officers are assigned, but then there are also supplemental units. So each district or each sector may have several other units where there's just 1 officer in the car. So there's a variety, but in a place as small as Wilmington, we have 16 square miles. If 1 officer gets sent, more officers are showing up anyway. If they're not otherwise committed, if they're not tied up on a complaint of their own, they'll go back each other up until they know that the scene is safe, that the people at the scene are safe, and that the other officers are safe. So the short answer is we have both. We have 2 officer cars, we have 1 officer cars, And now we have cars that have one officer and one mental health professional. So we deploy in a variety of ways so that we have the most flexibility and also the most coverage. If we stuffed all of our officers into 2 officer units, then that's fewer police cars on the street available to answer 911 complaints when they come in, less visibility, less proactive patrol. So we have to do it in a way that provides for the safety of our officers, but also provides for public safety and public service with the greatest coverage and flexibility.
All right. Thank you. That's enlightening. Appreciate it.
Susan?
Yeah, we had an episode 2 years ago in my neighborhood, and a police officer was quite a male, and he was responding to a request from the sister of my friend who does dog walking, and she was having some kind of an episode. And this police officer was just frantic to find her and treated her with such disregard that it was frightening to my other neighbor and I. And then another police officer arrived who was a woman who absolutely got out of the car and cared for this person, our friend, who was having some sort of episode. And she calmed her. She was just wonderful. But I felt sorry for the gentleman who was the first officer on the scene. And so I just wondered, how does somebody connect? I would have liked to have talked with somebody about the whole situation. What does one do when it was actually because of the behavior of this woman officer who arrived on the scene and who calmed things. But I just thought I felt sorry for the gentleman, the police officer who didn't seem to have a command of himself. And he was being rough with this woman who was having the issue. And so I was just wondering, is there a way to call and say, could some help? Could this police officer be helped with his way of interacting? I mean, when I'm hearing crisis intervention, you have programs to help officers deal in a better way.
So there are a number of ways that you could have something like that addressed. If it's something that you can do immediately, you can make a call into the non-emergency number that I provided, and you can speak to a supervisor immediately. We have sergeants and lieutenants who work 24 hours a day. And if you've witnessed something that's caused you concern, you can call our radio room and they will take your message, and a supervisor can call you back. That way it can be addressed while it's still fresh. The officer will know, the supervisor rather will know, they'll be familiar with the complaint because they will have just heard it. They would have been paying attention to the dispatches. And even if not, if you give them the location, it's pretty snappy for them to find the officers who were dispatched and find the situation that they were sent to. So the immediate answer is, if it's something that is happening now or has just happened, I would call in and ask to be connected with a supervisor. If it is something that you thought later, the next day or a couple days later, you're thinking back and you figure it may need to be addressed, there are forms on the city's website under the police department tab where you can send concerns to our internal affairs investigators, or you can still call the non-emergency number and have a supervisor call you back. We all have access to the same information. And if you call a couple days later, it's going to take some more research. It's going to take a little more time to find out who was there, which officers were sent, what they were sent to. But we can still get that information. All the officers' cars are tracked. All the complaints are logged. All the notes are logged by our dispatchers. So the information's there. It's just if it's a couple days old, it takes us a little while to get our thumb on it. But
Sure. Yeah, and I think most of us are reluctant to cause a problem for any officer. And for me, I felt like I don't want that officer to have discredit or something that would jeopardize his job. And so do officers get another chance? I mean, a chance to, but I do think that in this particular case, that gentleman needed help himself in how he handled a situation. But it didn't mean he was a bad police officer.
Right.
It
No,
just
and
meant, it just meant he needed this kind of help that you're talking about, this CIT. Mhm.
Yep, and that's always a question that we ask. We always ask our officers if something has happened that's maybe it's out of character for them. They've overreacted to something or they've acted differently.
Right, exactly.
We always ask them if there's some underlying cause, if they were having a crisis that day, if there's something going on off duty or at home.
Absolutely.
We look into those things. But as I said earlier, with people in crisis, if they've done something that constitutes a crime or a violation, we still have to address that. Just like with the police officer. So if a police officer is experiencing something that's caused them to act inappropriately, we now have two things to address. We have that cause to address to help the officer. We also have the inappropriate behavior we have to address because that needs to be corrected so that it doesn't continue. So we do have mechanisms in place to care for officers' mental health. I also happen to run that program. Somehow, at some point in my career, I ended up adopting all of the mental health, the community mental health programs and the internal wellness and officer mental health programs. So I kind of have all that. I got a degree in chemistry from Westchester in 1994, and I haven't put it to use one bit. I had to go back to school and get a degree in social work so that I could continue with this career the way that it's been.
Well, clearly it's your calling, Harold, so I think you're the right man in the right place.
To think I wasted all that money to the University of Pennsylvania system, though.
Nah. Nah. As I tell my kids, you know, my political science degree, my liberal arts degree means that I'm great at cocktail party conversation. So you too. Sandy, do you want to wrap up?
I just want to thank you so much for your presentation. I've been interested in this whole concept of the CIT training for a long time, and I'm just delighted to hear, you know, that it's being used in Delaware and to such a great degree. It doesn't mean situations aren't very complicated, but all the more reason to have all the resources combined. And I just am very, very pleased to hear everything you've presented and to thank you for what you're doing and for being here this evening. Really, really appreciate your expertise and your willingness to share it.
Thank you for that. Wes and I are always pleased to talk about this program. I think we're both so passionate about it. We're always happy to talk about it and share it and get the word out. Yeah,
absolutely. Thank you so much for having us.
And we will we'll put the link to our recording in the Weekly Word, our weekly e-newsletter, and people know already to go to our YouTube channel. As we're in contact with folks, we'll recommend that they watch because it was a very meaningful description of a program that's clearly desperately needed and gives us a sense that the right resources are being deployed in the right circumstances in a way that I think supports what most police force mottos revolve around, whether they're explicit or not, which is protect and serve. And clearly this program does both. So thank you. Thank you very much for being here. Thank you for the program. Next week, we will have Kobe Owens, who is the chair of the Wilmington City Council Reparations Task Force, who will give us an update on the Reparations Task Force report given to City Council and approved by City Council in early May. So we look forward to seeing you next week. Stay cool, by the way.
Thanks so much.
Thanks so much.
Thank you.
Thank you, Sue.
Bye.
Good night.